Hello, and welcome to the webinar, Cannabis and CBD for Cancer. I'm Dale Semler, manager of the Breast and Metastatic Breast Cancer Helplines at SHARE. Before the presentation begins, I'd like to tell you a little bit about SHARE. SHARE is a national nonprofit that supports, educates, and empowers anyone who has been diagnosed with women's cancers and provides outreach to the general public about signs and symptoms, because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars, support groups, and our helplines, please visit our website at sharecancersupport.org. All participants will be muted during the presentation. When Dr. Martinez finishes presenting, we will begin the Q&A discussion. You are welcome to submit questions during the presentation through the Q&A section at the bottom of your screen. When asking questions, please remember that Dr. Martinez is unable to give specific medical advice, so please keep your questions general in nature. This webinar is being recorded and will be available on the SHARE website soon. Now I'd like to introduce our speaker. Dr. Deanna Martinez is a professor of psychiatry at the Columbia University Irving Medical Center, where her research focuses on the neurobiology of chronic pain. Her interest in the topic grew from the need to find better treatments for this condition and from the recognition that many patients treat themselves due to the lack of options. Her talk will focus on the issues that cancer patients need to know when using medical marijuana. So without further ado, I'll turn it over to Dr. Deanna Martinez for this much anticipated webinar, Cannabis and CBD for Cancer.
Great, thank you. And thank you for having me today. So I'll dive right in, and I'm going to start by discussing the topics I'll be covering today. So I'm going to focus on research in humans. I won't really be discussing research in animals. And I'll be talking about the medical uses of cannabis, and I'm going to focus on placebo-controlled studies. I won't really be talking about uncontrolled studies. And then after talking about the research in humans, I'm going to discuss the risks of cannabis use, both cancer patients and for the general population. And then lastly, I'll provide ideas on lowering these risks. And I just want to point out that my goal here today is to provide the data that everyone needs to make an informed decision. You would have to decide for yourself pros or cons about whether or not you would want to try cannabis for various symptoms. My goal is just to give you the information to make that decision. So let's start with the definition of cannabis. Cannabis, the plant, and I'll be using the term cannabis today, is also called marijuana, weed, pot, and has many more names, but we'll stick with cannabis today. And then the cannabinoids are chemicals contained within the plant, and there are about 70. The best known are THC, which stands for delta-9 tetrahydrocannabinol, which creates intoxication or causes a high, and CBD, which is cannabidiol, which has few effects on brain function and doesn't have a high. So let's talk about where people get THC and CBD. So these could be from a plant, or you can also get THC from a dispensary. This can be legal or not, depending on the state you live in, or other sources, such as dealers or connections. And for this talk, I'll be talking about dispensaries versus other sources. And then CBD usually these days comes from from retail vendors, sometimes from state authorized dispensaries, although it can be a little expensive there. So most of the time, these are online or brick and mortar retail vendors of CBD. So how is THC taken? So the most common ways to take THC is to consume or smoke the plant itself, usually wrapped in paper or in a pipe, or oral cannabis has become more popular in cookies or in brownies. It can just be baked into these products. THC can also be consumed after it's been extracted from the plant. And this can be in an oil that's vaped in an electronic device called a vape pen. It looks sort of like an e-cigarette. Or there are also a number of oral products these days: tinctures, lozenges, edibles, candies, chocolates, and gummy bears. When it comes to CBD, there's also a number of products. CBD is usually taken when it's been extracted from the plant. Oral products include tinctures, lozenges, also edibles, which can be candy, soda, tea. There are skin products with cream and cosmetics that contain CBD, and it can also be vaped. Most cannabis plant, if it's obtained from other sources, is fairly low in CBD. So that's important to know. Most plant that's available across the country has low levels of CBD in it. In most state dispensaries, the state regulated type, rarely cover CBD-only products. Most products in state dispensaries have a mix of THC and CBD together. The main reason for this is because THC is more popular, and usually people can charge more for it because it's more popular. In order for CBD to be allowed for retail sale, meaning not in a state authorized dispensary, but in CBD retailers, which are all around us, it must be less than 0.3% THC. However, this is not really that tightly regulated, and I'll be discussing this more later in the talk. So let's talk about cannabis and the law. What is a law when it comes to cannabis? And certainly by federal law, any cannabis that has THC in it, unless it's this low variety, less than 0.3%, is illegal as of now. This may be changing, but as of now, this is illegal. Now, some states have moved to legalize cannabis, but there's a lot of variability by states. So some states have authorized dispensaries for medical use only, which means that the patient must be certified. Some states allow for medical or recreational use as long as you're over 21. That would be the states here in dark green. Some states allow for CBD with low THC. For example, in the light green shown here, this can be either retail stores or in dispensaries. And some states have no provisions for cannabis. And so they go by the federal law, which means that it's illegal. Now let's talk about the conditions for which medical marijuana or medical cannabis is approved across states. And this slide just shows the number of states that have approved all these different indications for cannabis. So as you can see, there's quite a list. Top of the list here is epilepsy, then we have cancer, there's also HIV and AIDS, there's PTSD, autism, lupus, and then my favorite is here, which is anything that a doctor thinks it would be good for. But let's ask the question, is there really research to support all these indications? And then the second question is, what is the data specifically on cannabis and cancer? And for today's talk, I'm mostly going to focus on this report. It was published in 2017, but it still applies today. Sometimes I update it with more recent studies, but this published report actually is quite a significant, timely, and valuable resource when it comes to the health effects of cannabis and cannabinoids. It was published by the National Academy of Science, Engineering, and Medicine. It's actually free. It's actually free online. If you want to find it, you can search NASM 2017 and it will pull it up. And as I mentioned, I'll be reviewing the placebo-controlled studies that have been done with the cannabis plant, which is usually TBC with low levels or no CBD, cannabis extract, which includes THC plus minus CBD. And then I'll also discuss dronabinol and nabilone. These are the FDA-approved medications that are made in a factory. And these come in pill form, and these are regulated like any other pharmaceutical medicine would be regulated. Okay, so what does the evidence show for THC? So the strongest support for the medical uses of THC includes pain. We'll start with pain. So research shows that THC can reduce pain. This has been shown in cancer pain, neuropathy caused by diabetes and HIV, fibromyalgia, multiple sclerosis associated pain, and rheumatoid arthritis associated pain. Secondly, there's data showing that cannabinoids, THC plus CBD, can improve muscle spasticity in multiple sclerosis. And then lastly, we have the FDA-approved medications. This is dronabinol and nabilone. These are FDA-approved for chemotherapy-associated nausea and vomiting and appetite stimulation in AIDS. That's it for the strongest evidence. Now, there's more moderate support for additional indications for THC. This includes anxiety. Now, these studies in anxiety have not been performed in patients who have an anxiety disorder. Instead, studies in patients who have a medical disease, medical diagnosis, such as chronic pain or MS, have shown an improvement in their symptoms of anxiety over placebo. When it comes to depression, again, studies haven't been done in people specifically diagnosed with depression. But if we're talking about patients with other diagnoses like chronic pain and multiple sclerosis, there was no change, no improvement in the symptoms of depression over placebo in patients treated with cannabinoids. And then sleep, there is data showing that there's a better sleep quality, fewer sleep disturbances, and a decreased time to fall asleep in patients with obstructive sleep apnea, fibromyalgia, chronic pain, and multiple sclerosis. And then there's some limited evidence. There's some early studies coming out looking that cannabinoids might help, or THC might help for PTSD OCD, and Tourette's. These are still small studies, they're in need of replication, and that work is going on today. At the end of the talk, I will review everything I've said here so that you don't have to keep track of everything right now. So what's the evidence, the medical evidence, this research for CBD? Well, the strongest support for CBD is epilepsy. This is childhood epilepsy caused by Dravet syndrome, Lennox-Gastaut, or tuberous sclerosis, and high doses of CBD can help patients who have uncontrollable epilepsy. There's some limited evidence, but promising that high-dose CBD could help with psychosis and schizophrenia. And then there are some small studies indicating that CBD could help with social anxiety disorder. These are small studies in which patients were given 1 dose of CBD and they showed less anxiety, but this needs to be replicated in larger studies. And then there's one small study in Parkinson's disease showing that CBD at doses of 75 and 300 milligrams a day improved quality of life. However, CBD did not change the actual symptoms of Parkinson's, such as tremor, gait, or movement problems. Now let's talk specifically about cannabis and cancer. Now, if you Google cannabis and cancer, there'll be many websites telling you that cannabis can cure and treat cancer. And it is true that there are a number of studies in rodents showing that THC and/or CBD can reduce tumor growth in studies of breast, lung, liver, and prostate cancer. However, at this point, we cannot say, and we don't know that this means that it works in humans. It's really not known if THC or CBD can reduce tumor growth in humans, and if it did, what dose would be needed. There is one small study that has been done looking at the effects of cannabis to treat cancer, and that's with glioblastoma or brain tumor. Again, it was a small placebo-controlled study in 21 patients using nabiximols. Nabiximols goes by the brand name Sativex. This is approved in Great Britain, and it's a combination of THC and CBD. It's a mouth spray. All patients were receiving standard treatment, standard chemotherapy, and the results show that patients with brain tumors or GBM had a greater survival. They had 83% survival if they were treated with nabiximols or cannabinoids versus those 44% who only received placebo. And importantly, there was no effect on the nabiximols on the metabolism of the chemotherapy that they were receiving. So this is the only study that I know of in humans looking to see if cannabis actually can be used to improve cancer treatment. However, there are some risks when it comes to cannabis in cancer patients. And this is a very important study. It's a small study that came out recently, 2020, and it was in patients who had metastatic cancer, all different types, who were being treated with immunotherapy. They were receiving checkpoint inhibitors, and they used cannabis compared to patients who didn't. As I mentioned, it's a small study, 34 who used cannabis, 68 who didn't, but still what the results showed is that the patients using cannabis did worse than those who weren't. The study was done in Israel, and the patients were taking prescribed cannabis products. Those studies show that there was a decrease in survival and an increase in tumor progression of cannabis users compared to non-users. And I have the data over here. Here is these are survival curves for the number of months for patients. And these are in gray are those who are not using cannabis, and in orange are those who were. So this is important. This data shows us that if patients who have metastatic cancer and who are taking immunotherapy at this point in time, until we know more, should not be using cannabis. And we don't know why this is happening exactly. Other studies indicate that cannabis might interfere with the ability of the immune system to kill tumor cells, because when you take immunotherapies, you're relying on your immune system to take out tumor cells, and cannabis may be inhibiting that. We don't know why for sure, but at this point, I would say that it's not a good idea to take cannabis if you are taking immune therapies. And then let's talk about patients in other kinds of treatment. What about cancer patients who are being treated with chemotherapy, surgery, or radiation? At this point, we don't really know. We don't have data suggesting that cannabis is helpful or hurtful. Nonetheless, I would say that if you're undergoing active treatment, meaning chemotherapy, surgery, or radiation, it's best to avoid, reduce, or stop cannabis use during this time. And the reasons for this are as follows. There's a potential for pathogens, meaning bacteria and mold, in cannabis products. So if you're taking chemotherapy and you're immunocompromised, these could be dangerous. This is less likely to happen in products from a state dispensary, but if you're taking any other product, it is a risk. It's also possible that THC and CBD could impact the metabolism of chemotherapy. We don't know if it does or doesn't at this point, but it's a possibility. And then THC and CBD could impact the ability of your body's immune system to kill cancer cells, as like with that previous study. We don't know if this isn't the case in patients who aren't have metastatic disease, but I would still say if you're taking chemotherapy and we're relying on your immune system to do some of the work for you in killing cancer cells, it's best to avoid cannabis. And then lastly, when it comes to patients recovering from surgery, cannabis can have an effect on heart and lung function, and I'll talk about this a little bit more later in the talk. So now let's talk about the general risks of THC. So independent of cancer patients, what are the risks to THC to the general population? Well, the main risks are those of dizziness, intoxication, drowsiness. There's a risk of falls in medically ill patients. There's risk of accidents, unintentional overintoxication. There's a potential risk of drug interactions, a heart attack. There's some risks to lung health and the risk of addiction. I'm going to go over each of these risks at this point. So accidents, THC, like any other drug, impairs physical coordination and decision-making, and there's an increased risk in accidents. Normally, when we think of drug use and accidents, we think of motor vehicle accidents, but other things are also risky, like swimming or biking. So any intoxication to any drug is a good reason to not drive, swim, bike, hike. Ideally, just stay at home is the way to go. Over-intoxication. So cannabis alone is not known to cause a lethal overdose, but people can become over-intoxicated, and the symptoms can be very distressing. They include paranoia, delusions, a fast heartbeat, low blood pressure, nausea, and vomiting. And this often comes up with edibles, not always, but it can. And I show here some data. This is looking at the peak intoxicating effect of cannabis when it's smoked, that's here in this curve, and when it's consumed orally. For example, either edibles like gummies or candies or cookies or brownies. And what you can see is if it's smoked, the peak high occurs quickly in about 15 minutes, and then it starts to dissipate. With oral THC, the peak high doesn't happen for about 2 or 3 hours. So often people will take an edible here, they think nothing is happening, and they may take more. And that can lead to over-intoxication many hours later. So it's a risk to know about. With edibles, the effect doesn't kick in for a few hours, so it's important to not take too much. And then in patients who have medical problems, it's important to realize that there could be an interaction between THC and other medications, especially blood thinners, epilepsy medications, or antifungal medications. And if you're taking any of these, and if you're using THC, you should discuss this with your doctor and check the blood levels, especially blood thinners and epilepsy medications. Okay, now I'm going to talk about the heart and lung effects of THC, beginning with heart health. So there are now studies showing that cannabis, especially THC containing cannabis, is associated with an increased risk of heart attack. This occurs in about 1.5% of cannabis users. This means it's a small risk, it's not a huge risk, but it does mean that any chest pain or pressure should be taken seriously, and the person should call 911. Now, the risk of having a heart attack is highest in people with a history of heart disease, but sometimes we do see heart attacks in young, healthy individuals using cannabis. So far, most of the reports are with smoked cannabis instead of oral products, but we don't know this for sure. So it's just important to be aware of this potential risk. And then when it comes to lung health. So at this point, studies show that cannabis is not associated with lung cancer. That's good to know, unless it's mixed with tobacco, and then there is a risk. Regular cannabis smoking can be associated with a chronic cough and chronic phlegm production. These symptoms do resolve when smoking stops. And then lastly, there is a lung disease called a volley. This is associated with vaping, specifically THC or CBD. And even though cases have gone down, it's generally best to avoid vaping devices if they contain THC or CBD, especially in patients who have medical problems. And then lastly, I just want to say that there is a risk of addiction when it comes to THC. Cannabis, like any other drug, including alcohol, can cause an addiction. We're familiar with alcohol, where some people are social users, some people have an alcohol problem. The same applies to cannabis. And also recent studies do show that patients who have chronic pain who are using THC may be at a higher risk for developing an addiction. And here I have the criteria for diagnosing a substance use disorder. Fortunately, it's easy to diagnose an addiction. You just go through these 11 questions and figure out how many times the answer to this question is yes. If you answer yes to 2 or 3 of these questions, then you have a mild substance use disorder or a mild cannabis use disorder. Moderate is 4 or 5, and severe is 6 or more. And these questions, I won't go through them all today. You can look them up online, but essentially they include craving for the drug, taking more than intended. A big one is the failure to fulfill major obligations or using the drug instead of taking care of things at homework or school. Repeated use of the drug in dangerous situations, and then tolerance and withdrawal are important. If you're developing tolerance to THC, meaning that higher and higher doses are needed to have an effect, then you should really consider whether you need to cut down your use. And then symptoms of withdrawal. Cannabis can cause withdrawal and people stop taking it. The symptoms include anxiety, insomnia, nausea, abdominal pain, irritability, and fatigue. And so this can be a real issue when people are trying to change or cut down their use. Now let's switch to CBD. What are the risks of CBD? So CBD has much fewer risks compared to THC. There is a potential for liver injury, but this is at very high doses. This is at 1,000 milligrams a day or higher, which is not usually what people are taking. There are side effects such as sedation, loss of appetite, and GI upset or abdominal pain. This is also with high doses. Like THC, there can be a drug interaction with antiepileptics, blood thinners, and antifungals. We don't know this for sure, but if you're taking CBD on a regular basis or taking high doses, you should have these blood levels checked. And I would say the biggest issue when it comes to CBD is that of taking an unregulated product. And I'll discuss that now. So most CBD products from retail stores are not tightly regulated, which means that they're not tested for purity, and I'll discuss that more. And the dosing on the label isn't always accurate. If you obtain CBD from a state dispensary, these are regulated. They tend to be expensive, and often state dispensaries have products that have a combination THC and CBD rather than CBD alone. Importantly, there was a recent report of the FDA to the US House Committee in 2020, and it showed that about 50% of CBD retail products available, meaning online or from stores, contain THC above the allowed limit. So what this means is that you may be taking a CBD product and you're not expecting any intoxicating effects, and these may happen nonetheless. So some of these products have THC, Delta 9, and some of them have Delta 8 THC. Delta 8 THC is very similar to Delta 9 THC. It's lower in potency, but it does cause intoxication. And I'm showing the two of them here. Here we have Delta 8 THC, Delta 9 THC, and this is CBD for reference. As you can see, they're very similar molecules, which means that Delta 8 can have some intoxicating effects. So the issue here is if you go and you buy CBD, let's say you buy it from an online retailer and you start taking it and you don't expect there to be any intoxicating effects, meaning sedation and whatnot, that can still happen. So I just say, if you're taking CBD, you should always be prepared for the fact that it might have some THC in it. It might cause you to feel sedated, lightheaded, or intoxicated, and you could test positive for a urine drug test if you're being tested. When it comes to buying CBD, as I mentioned, it's not tightly regulated. So most of the websites where people buy CBD from don't have extensive safety testing. If you're a consumer and you're buying from a website, I always say you should ask for the certificate of analysis from that website. This is a certificate that looks at all the different cannabinoids in the product and anything that else might be in there, such as bacteria, mold, pesticides, or heavy metals. You can ask retailers to see this, and some will provide it, most do not. However, from what I can see, most retailers don't have a COA that's done by an independent lab. This is mostly done by themselves, which is better than nothing, but still, it really is time for retailers to have a certificate of analysis that's done independently so that patients and consumers know what they're taking when they buy CBD products. I'll talk briefly about where you buy THC. This can be from state-regulated dispensaries or other sources that aren't regulated. The advantages of buying THC products from the state-regulated dispensaries is that these are tested, but still you should ask for their certificate of analysis. So these are tested and they're accurately labeled when it comes to the dosing. What are the cons of going to a state-regulated dispensary? Well, normally it's expensive and it's not covered by insurance. And some states require medical certification, and this can also be expensive. When it comes to other sources, again, remember this is like dealers or connections. What are the positives? What are the pros? Well, the first pro is it's not as expensive. And the cons of buying THC products is that they're not tested for pathogens or pesticides. You don't know the dose. And it's largely still illegal, although it varies by state. So I just want to add that, if you're buying a THC product, even if it looks like a tincture or a gummy bear, that doesn't necessarily mean that it's a dispensary product and that it's been tested. There are now products widely available for THC that come in all different forms. So you really have to know whether that came from a dispensary or from other sources before you can know if it's labeled properly and has been tested. Okay, so I know I went over a lot of data and now I'm just going to review. So I'm going to start with a review of what do we know? What do we know that THC and CBD work for? Well, let me begin by saying that there's just a shortage of placebo-controlled studies. These are really important, and researchers are trying to do these. There are a number of regulations that get in the way, but we are trying to make progress on this. Nonetheless, we can say that THC has evidence to support its use for pain, spasticity and multiple sclerosis, chemotherapy-induced nausea and vomiting, and weight gain in HIV. We have moderate evidence that THC can help with sleep and anxiety in medical patients. When it comes to CBD, we have evidence that it helps with epilepsy and perhaps schizophrenia. And then we have some limited evidence saying that it might improve quality of life and social anxiety. So back to this graph that I showed you previously, these are all the indications for which cannabis is approved across states. And as you can see, we don't have evidence for most of these. So even if medical cannabis is allowed by a state, that doesn't mean that it's been shown to work. It means that the evidence is really still lacking. So importantly, what can we say about cancer and cannabis risk? As I said, current studies indicate that patients on immunotherapy should not be using cannabis. I would also recommend that patients undergoing active treatment with chemosurgery or radiation avoid or stop their cannabis use. And when we talk about why cancer patients are mostly using cannabis, the symptoms that people mostly report are pain, anxiety, and sleep. And I would just like to point out that if you're undergoing active treatment, we can treat pain, anxiety, and sleep with other medications. So if you're experiencing these symptoms, which is very common in cancer patients, especially undergoing active treatment, please discuss these with your doctor. If you're given a medication to help with anxiety by your doctor and it's not working, talk to them about it, change the medication before moving on to cannabis use if you're under active treatment. There are many options, and patients really should be able to discuss these with their doctor. I would say most oncologists these days are very aware of the need to treat things like pain, anxiety, and sleep. So what are the risks of THC if you're not in this group of cancer patients undergoing active treatment? I'm going to go over the risks here, and then in the boxes, I have ideas for reducing the risk. So the first risk is that of side effects, meaning intoxication, drowsiness, over-intoxication, which can make people feel delusional, faint, or paranoid, accidents and falls. And, the issue here is really to reduce the risk. Lower doses are safer with more time between doses if you're taking multiple doses. And I just want to point out, remember that oral THC, if it's in the form of edibles or brownies, has a delayed and long-lasting effect. And that needs to be known by everyone. There is a risk of interactions, meaning blood thinners and some anti-epileptic or antifungal medications. If you're taking these medications and if you're using THC, discuss these with your doctor and check blood levels. And then there's the risk of heart attack, lung health, and addiction. And the way to offset these risks is to know the symptoms and know when to get medical help. I would recommend avoiding vape devices. Those do have more risk to them. Although a heart attack in cannabis use is not common, I would not ignore any symptoms of chest pain, pressure, shortness of breath. And again, I would recommend reviewing the 11 criteria for a cannabis use disorder so that you know the symptoms of an addiction. And now, what are the risks of CBD? As I mentioned, these are liver injury, but high doses, sedation, loss of appetite, high doses. Again, drug interaction with blood thinners, you can have these tested. And again, the biggest risk is that of taking an unregulated product. It's hard to know if a CBD product has THC in it. It can have Delta 9 or Delta 8 THC. It's also important to remember this. If you buy a CBD product from an online vendor and you get the oil or tincture in the mail and you try it and it doesn't have any effects, it doesn't have any sedating or intoxicating effects, that's fine. But even if you buy that same dose from the same vendor another time, it can change. It could have THC in it at that point. So just know that each time you obtain a new CBD product, you need to be aware that it could have some THC in it, and it could have symptoms that you're not expecting. So the main issue here is if you're trying a CBD product, make sure that you're at home, you have nothing planned, no plans to go out. Don't take a new CBD product and then get in your car and go to work because it can have a delayed effect if it has THC in it. I would suggest that you get a certificate of analysis from the vendor. And then lastly, CBD products from state regulated dispensaries do have more testing and the labeled doses are accurate, but these are expensive and most people aren't obtaining CBD from state dispensaries. That is the end of my talk today. I know I've covered a lot of information. There may be a lot of questions. If you want to find me, this is my lab. We're a very friendly group. My email is here. If you want to look me up, you can search Martinez Lab at Columbia University and it will pull up my website. And I'd like to thank you very much. And we have time for questions.
Yeah, so now we're going to start the Q&A. You can still submit questions in the Q&A section at the bottom of your screen. We will try to get through all these submitted questions, but we may not be able to due to time constraints. So Dr. Martinez, we got quite a few questions for you. I've tried to group them together so that you might be able to answer more. The general questions about how do you get prescribed a CBD product or a THC product? Is a doctor's script needed? And where would you get that filled?
So that depends on your state. And every state has different rules. So the only way to really know is you have to go by your state laws and look those up. So most state dispensaries carry THC products and they carry THC plus CBD products. Most of the time, they don't have CBD only products. That is changing. It depends on your state and the dispensary. So if you want CBD only, that's usually harder to find. But whether or not you have to be authorized and what medical condition you have to have varies from state to state. Most states, you have to pay for that yourself. It's out of pocket. And I don't know of any insurance companies that covers medical cannabis at all on its own.
Okay. Who's the best resource to actually figure out what the best dosage would be? Is that your doctor or is that somebody at the actual dispensary?
That's an excellent question. And so your doctor generally, because THC is illegal on a federal level, your doctor is not allowed to prescribe an amount. All they can do is verify that you have a qualifying condition in your state. So it's actually the dispensary that will decide on the dose. And that's a lot of variability. I've talked to some people, some pharmacists at dispensary who know all the data, they know all the information, and others who don't know as much. So it can be very, very variable. It's a great question, and there's not a great answer to that at this point.
Okay. Is THC safe with hormone positive breast cancer?
We again don't know the answer to that question specifically. I would say if you're hormone positive and you're undergoing chemotherapy, surgery, or radiation, I would say it's not safe for anyone, hormone positive or not. If we're talking about down the road, if you're taking tamoxifen or aromatase inhibitors, we don't have any data showing that THC or CBD can interact with those. But I would still, if you're taking those medications and you're taking THC, I would let your doctor know. And I would also be careful, like it could change the metabolism and the efficacy. We just don't know.
Okay. Is there a CBD that you would recommend that helps with libido?
I don't know of any data showing the effect of CBD on libido. It's a complete unknown.
Okay. Is there, for specifically cancer, is there a way to dose the product that instead of, like you said, vaping can have side effects? Is it best for gummies? Is there anything that indicates one is better than another?
In general, if people are taking cannabinoids, I generally recommend oral products. The lungs are just more susceptible to pathogens. The lungs are just more susceptible to illness. If you think about evolution, like we didn't evolve to take in anything into our lungs except air, but our intestinal tract evolved to take in, frankly, all kinds of garbage, right? like people have been eating garbage for years. So your intestinal tract has a lot more immune cells in it. It's just more set up to fight off pathogens. So in general, if you have medical problems, even if you don't, I would recommend oral products over anything that's inhaled.
Okay. When you're buying a product and the seller claims that it's been independently tested, I know you touched on this. Is there a way to check other than asking them for that, the data that indicates, what's actually in the product?
There is not. And I can't stress enough the importance of asking for a certificate of analysis. Some online vendors do have them. In my experience, some of them from Colorado tend to have certificates of analysis. I used to say which websites had them and which don't, but it keeps changing. Sometimes they post it, sometimes they don't. Sometimes you have to buy the product first and then you get a lot number and then you can look up the certificate of analysis. I find that highly annoying. I don't know why we can't see it before you buy it. That said, I don't know of any vendor that has a COA that's done by an independent lab. It tends to be done by their own labs. Now that's better than nothing, but still we really need a system where you can buy CBD products from retail stores, not necessarily a dispensary, and have an independent assessment of what's in that product.
Mhm.
And we haven't reached that point yet, unfortunately.
Okay. In terms of, the THC having an effect on pain, how does it specifically do with neuropathy and metastasis that's gone to the bones, the pain associated with that?
Mhm. What THC does is it binds to cannabinoid type 1 receptors, CB1 receptors, and those have a role in modulating pain. Just like opioids bind to mu receptors, and those receptors have a role in modulating pain. So, we all know that opioids are the most powerful, medications to treat pain that we have, right? We have nothing more effective than opioids. THC is about as effective from some of the studies we've seen, as effective as a low potency opioid. So, in some ways, if you're going to use THC for pain, you should consider it as being a low potency opioid and treat it that way. It's certainly safer than opioids in some regards, but THC on its own, has its own risks. Opioids can lead to addiction, so can THC. That risk is bigger with opioids than it is with THC, but nonetheless, we need to think of THC when we're talking about pain as being a low dose opioid.
Okay, actually, that was another question was, the comparison between an opioid addiction compared with a THC addiction.
Mhm.
So, there is a source, there are studies that show that THC is indeed addictive.
Right. If you're talking, like, let's say we took 100 people who took opioids and 100 people who took THC. About 25% of that 100 in the opioid group will develop an addiction. In the THC group, it's lower. It's between 10 and 15%. So it's
Okay.
less likely to happen, but still it can happen. And, and we know that, any addiction has an impact on quality of life. So, and I just want to stress, when we think of addiction, we often think of people who are, lying on the street and, they'll do anything for their next drink or their next fix of opioids. That's not what addiction normally looks like. That's one end of the spectrum. It's usually mild, and we have to do a better job at catching a mild addiction and doing something about it so that it doesn't get worse. we all know that the earlier you treat any disorder, the better off. It's easier to treat an early diabetes than a diabetes that's already gotten to a point where, it's very difficult. So I can't stress enough the importance, if you're using a drug, any drug, I don't care if it's alcohol, nicotine, THC, whatever it is, review those 11 criteria. You can look them up anywhere. Answer very honestly those 11 questions. And if you're getting to the range where you're answering 2 or 3 or more, it's time to do something about your drug use.
Okay. And is there a specific study, or is it many studies that have indicated that there is an addiction?
Oh,
Someone
many.
was asking yeah. Okay.
Yeah. Many back decades. Yes.
Okay. Is CBD safe for patients using PARP inhibitors? You specifically mentioned immunotherapy, but
we actually don't know. So, when I'm talking about drug interactions, these are at this point mostly theoretical. There's a reason to think that they're both metabolized by the same liver pathway. So it's really mostly hypothetical, with the exception of antiepileptics. That study was done in the epilepsy study. So patients who are taking antiepileptics and high doses of CBD, there is a drug interaction. For the most part, it hasn't been looked at. We don't have lots of people showing up in the emergency room, because of a drug interaction when they're using cannabis and these drugs. So it's not going to be a profound effect, but there could be a subtle effect, and it could change the efficacy of the medication that you're taking.
Okay. Can you touch on CBD oils and how effective they are topically?
That's a great question. We do know that CBD is absorbed through the skin. When it's absorbed through the skin, you probably don't get very high blood levels on it. There was one small study from some time ago showing that it can help with mild inflammation of the skin, CBD. But if you're trying to get doses of CBD, let's say for other indications like sleep, anxiety, whatever, skin preparations probably aren't going to do very much. And if you're talking about CBD for pain, first of all, we don't have data showing that CBD does anything for pain, right? That data is THC, not CBD. If you're taking CBD for pain and you're rubbing it on the area, it's probably not doing a whole lot.
Okay.
Yeah.
All right. Yeah. Someone asked specifically, is there a difference between, I'm sorry, let me find it, indica, sativa, and hybrids?
There is not. So I understand if you go into a dispensary, there's a lot of different products with a lot of different really great names and a lot of different appearances. But people will often tell you that there's a difference between indica and sativa. Studies actually have been done to look at this, looking at the genetics of these different strains. And honestly, there's really not a scientific difference between them. The cannabis plant is very it mutates rapidly. So there's crossbreeding is very easily, the plant is really easy to crossbreed and to change its genetics. And so there really isn't, differences in strains or species at this point.
Okay. Someone asked, does Rick Simpson oil kill cancer cells? Are you familiar with?
I am familiar with Rick Simpson oil, and I will tell you that it does not. I understand the Rick Simpson oil study. The story behind Rick Simpson is that he had skin cancer, which was probably basal cell, and he applied this topically to the tumor. That is not the same as having any other type of cancer, in your body, whether it's breast, liver, prostate, uterine, cervical. It is not the same thing at all. And so I can't stress enough the importance of sticking with tried and true treatments. I understand on a deep level that chemotherapy is miserable. It's a horrible process to go through. It's long, it has terrible side effects, but I can only say that we've been studying treatments for cancer for the past 50 years, and these studies are very well done and they're very controlled. Doctors are not giving patients chemotherapies that they haven't been tested. It's just, this is what works. So I can't stress enough the importance of sticking with an established regimen for cancer versus other treatments like Rick Simpson oil. And then secondly, as I mentioned, if you are in the category of patients who are using immunotherapies or other of checkpoint inhibitors, I would definitely not be using high potency substances like Rick Simpson oil. I think that study that I referred to, the one from Israel, is small. It's not definitive. We need to replicate this in thousands of patients, but right now that's the data that we have, and it's very concerning. And I think it shows that that is a major reason to not use cannabis in those patients.
Has there been any study that you're aware of that shows if hormone replacement therapy, if you're taking THC or CBD, whether it competes with hormone absorption?
We don't know. The studies to my knowledge, have not been done at this point. So we honestly don't know.
Okay, let's see. Is there any certification or registry for new clinics that are popping up so they can assist patients with determining THC, CBD, ratios or recommended doses?
That depends on the state, and it depends on pretty much the day of, things in every state are changing incredibly rapidly. And so it's very hard to keep up. For example, in New York State, medical marijuana is available. It is legal. It's pretty well tested. And at the dispensaries, I would say the pharmacists I've talked to do know what they're doing. In other states, things are changing very rapidly. For example, we're all familiar with that, cannabis, California has had medical cannabis since the 90s. Up until recently, California actually had some of the worst medical cannabis available because it wasn't tested. It wasn't tested for purity, and the dosing wasn't accurate. California has since changed that at this point. So that's what I mean. Things are changing rapidly. So the best you can do is look at your state laws. And if you're going to any of these locations, ask them for their certificate of analysis. Ask them to show you the evidence that they have that their product is safe and tested, and ask them what experience their pharmacist has, what training do they have.
So there's no federal regulation in place or being talked about
It's being talked about, but remember, on a federal level, this is all illegal still.
Mm-hmm.
So until that changes, there will be no federal regulations.
Someone had asked, you mentioned that nausea is obviously something that cannabis treats, when someone's going through chemotherapy. Someone wants to know if that is also the case, if you're actually taking a chemotherapy pill.
So the FDA-approved medications do apply to all forms of chemotherapy-induced nausea and vomiting. However, what I do want to point out is that there was one study that looked at cannabis versus traditional treatments for nausea and vomiting, like compazine and other medications, and there was no difference. So people who have chemotherapy-induced nausea and vomiting, I would recommend that you first start with the prescribed medications that your doctor will give you before moving on to cannabis.
Okay.
No data to suggest that cannabis will be more effective than those.
And would that be a discussion with an oncologist?
Yes.
Okay.
So I would talk to your oncologist. You're having nausea and vomiting with chemotherapy. They know how to handle this. This is bread and butter for them. It's going to be the very rare patient who needs dronabinol or nabilone instead of established treatments. It may be, and they know how to use those medications too.
Okay. There are just several questions, and I know we touched on this in terms of, how to know what ratio to take. Is it trial and error when you're, in not a dispensary, but a store that, you talk to someone, maybe they say the ratio should be 10-1. It turns out you're not feeling any relief. You go back and just keep trying other ratios.
It is very much trial and error. The only studies that have really been done looking at THC and CBD ratios are some of those studies that I showed with multiple sclerosis and in the UK, and the one study in glioblastoma, and a few other studies, and those are a 1-to-1 ratio. But we also know that CBD alone has to be taken in higher doses. So the studies that I showed you where CBD did have an effect, that was the quality of life in Parkinson's, some anxiety. Those doses are on the order of, anywhere from 75 to 400 milligrams of CBD. And I'll tell you right here, if you go to your everyday average CBD retailer and you buy a bottle of CBD, that's going to be almost the entire bottle to get that dose of CBD.
Right.
So, so we really, when it comes to CBD, we just don't know enough. We don't know the doses that you need to take, and we don't know what it all works for. And I'm not saying that if you want to try it, if people want, I'm all about making your own decisions. If you want to try it, feel free to try it, but you should just know what to ask for. You should know what you're getting into. And you should also know that, a placebo effect is very common. We see placebo effects all the time in the research we do. There's nothing wrong with a placebo effect, but you shouldn't be spending, $80 for a placebo effect, right?
A few people have mentioned an organization called Leaf for All, and Four Pillars Denver. Are those sources you're familiar with, and how can we tell when there's so many things popping up on, the internet, what is valid and what isn't?
I don't know those particular organizations. And as it's been a while since I've looked. Sometimes I go through the websites and check things out, but they really come and go. They come and go so quickly. There are some organizations that are testing CBD products. There's one called US Hemp Authority, but they have yet to publish their methods online publicly. And so I have not endorsed any of them because I haven't seen a single entity that shows me in a public and upfront, transparent manner how they're testing products.
Okay. And, there's obviously a million brands out there. And, if you were to Google, you would find raving reviews about every one of them. Mm-hmm. Is there a resource for comparing brands that are out there that are considered?
Right. There is not. There have been, different organizations that are intending to do this, but to my knowledge, no one has done this yet. And it's very difficult because remember, most CBD products are made from the cannabis plant. And as I mentioned, the cannabis plant morphs and mutates all the time. Mm-hmm. So you can have one batch of CBD that has no THC in it, right? And then the next batch will. And so that's part of the issue.
Like a moving target. Mm-hmm. Yeah.
And I do want to stress this point, when you buy a CBD product, it might have THC in it, either Delta 9 or Delta 8. So be aware of that. Like, as I mentioned, I've seen many patients who started taking CBD for their neuropathy. They thought it was helping. They got a second batch, took it in the morning, and then went to work and all of a sudden felt very intoxicated and drowsy. So be aware that this can happen. Always, if you're starting not only a new medication, but a new batch, home in the evening, weekends, don't have any plans because the likelihood that THC can be in a CBD product is about half the time.
Wow, that high. Someone is specifically asking about vaginal suppositories with CBD and CBD oil. Are these safe? Do you know anything about them?
They're not tested. We really don't know. We really don't know. Again, my druthers are oral because I just know that the GI tract can handle pathogens, but we don't know about mucosal absorption. It would probably be the same, but I can't say that it's been tested.
Okay. You mentioned the studies that are being conducted in Israel was the most recent study. Are these studies also going on in the United States? Are we?
Oh, yes. And I often get asked that question. Am I only referring to studies in the US? I'm talking about studies that have been done anywhere across the world we're looking at. And, there are a number of investigators in the United States who are trying to study. We all want to study placebo-controlled studies on the medical uses of cannabis because the potential really is there. The problem is the regulation. And let me be clear, the problem isn't just the regulation. It isn't just that the FDA or the DEA is problematic. They used to be problematic, but these days they're willing to work with you. Our problem is that we don't have a manufacturer who's willing to do all the testing that the FDA requires. Mm-hmm. And it doesn't matter what state I live in. It doesn't matter if I live in Colorado or if I live in Utah. I can't do a study with medical cannabis unless I have a product that I know has been tested and is safe.
Okay. Mm-hmm. Well, it seems kind of crazy that, with these acceptance for being able to use these in state by state, making them more legal. And there's nobody really looking at, the efficacy or, regulation. It's kind of scary.
It is time. I mean, for years now, I have thought that, cannabis will be made not Schedule I anymore, that it will, these things will change, and it's been slow going. And what's happening as a result is that states are changing their laws without the evidence to support it. And it's unfortunate because there really is some real potential for THC and CBD as medications. We know this mostly from rodent studies, which I didn't go into, but we need to be testing this in humans. And we need to be doing placebo-controlled studies. Without a placebo control, you don't know if the effect you're getting is just a placebo effect. So
someone was talking about a specific slide that you showed that indicated better outcomes for cancer patients. And it said it advised what type of diagnoses were studied. Do you know which slide they're referring to?
I don't. The only studies
here, I'm going to guess they're referring to the types of cancer diagnosis. So if it's, for instance, if it's breast cancer, what stages, what types, like you mentioned the estrogen positive.
Right. So there are studies in rodents showing that THC and CBD can reduce tumor growth. And that's in a lot of different cancers. It's breast, prostate, liver, and I don't remember what all else. Those are rodent studies. The only study in humans where cannabis has been shown to have an effect when it comes to cancer is glioblastoma. And that was one very small study. It had about 20 something participants in it, placebo controlled, and it showed that the patients with glioblastoma with brain tumors who took cannabis product, THC plus CBD, lived longer than those who didn't. Brain tumors are very aggressive. So it is, it's very promising that they had that effect, but again, it was a small study and it needs to be replicated. Okay. That's the only human study that I know of where cannabis has been shown to have a beneficial effect in cancer.
Well, I think this is a great question to end our question and answer session. Someone wants to know if you have any opinion on Martha Stewart's newly released CBD gummies. I guess everyone's getting into the business.
I guess so. I don't know about her product specifically, but all I can say is, if you're a provider, if you're a vendor of CBD, somebody needs to step up to the plate and provide not only do the real testing, maybe some people are, but show the data, provide the certificate of analysis.
So always ask for the certificate of analysis. And if you can't find it, maybe try a different source.
Someone else.
Because there's plenty of people out there doing this. So,
right.
Okay. I believe that is answering most of the questions. And so with 2 minutes to spare, if you have anything you wanted to add, advice for people when they're trying to determine what to take.
My best advice is really discuss this with your doctor, with your oncologist. Just let them know. Most oncologists they're not biased. They don't have a firm opinion. Most oncologists don't really know exactly what the data is because nobody knows exactly what the data is, but it's important that they know. So if you're starting to do worse, if you're not responding, they need to know everything that you're taking. So I can't stress enough the importance of sharing this information with your doctor.
Especially since you brought up the latest study that shows that it actually can be detrimental,
right,
in certain cases. So talking with your oncologist would certainly be the first step.
Very important. They just need to know.
Okay, well, that's great. So I want to thank you so much, Dr. Martinez, for the informative program, and thanks to everybody who came today. Thank you for participating and submitting your questions. Please take a moment to fill out the survey at the end of the webinar. The survey will show up in the browser when the webinar ends, and the link will also be in the follow-up email. All surveys are anonymous. And again, please check out Chair's other educational programs and support groups on our website, as well as volunteer opportunities. Thank you once again, Dr. Martinez, and thank you all for coming.
My pleasure.
Bye.
Bye.